Hello, this is Kirk Weber of Weber Chiropractic in 1808 Route 422 East in Fenelton, 724-285-9093. Hey, and I'm here today to bring you another message about things chiropractic. My big question for today is, how does chiropractic work? And more importantly, why is it important for us to know how it works? It's been my experience as a father, as a coach, and as a chiropractor that the more that we have an understanding as to how and why we're doing something, the better results we can find with the people that we're working with. The explanation of how chiropractic works that was used for decades is clearly not enough for today's 21st century population. The old definition that a vertebra or a disc was out of place, or that there was a cold in your back, or that you needed cracked in, is no longer sufficient for today's needs. Now, that was an acceptable explanation years ago. In years past, in my past, I can remember seeing television commercials on TV for cigarette smoking. Now, at that time, the doctor was this venerable, wise, respected person who everyone looked up to because the doctor had been educated. He knew. And you weren't to question the doctor. So in that commercial, the fellow would come out with a white lab coat on. He'd be holding a clipboard with a couple of official-looking papers on it. He'd have a stethoscope around his neck, and he would look into the camera and he would tell you that 8 out of 10 doctors prefer the taste of Camel cigarettes. Now, the inference was very clear. The inference was the doctor was educated, the doctor was smart, not to be questioned, and he preferred the taste of Camel. You should too. The subtle inference of cigarette smoking was not harmful was made because it was a doctor who was smoking. Right? And we can clearly see in today's society that those kinds of commercials, that kind of thinking, just is not right, and we shouldn't be doing it. So, how does chiropractic work? Well, let's take a closer look at what happens when we have an injury or when we have a disease state, so we can define what chiropractic is and how it works, so that we can make a better definition of what is chiropractic. When you have an injury or you have a disease, the body's response is inflammation. Now, inflammation is fluid. It's a transport method, a way of getting all of the raw materials to the site of injury, to the site of disease, to institute a repair. There's fresh nutrients, there's fresh energy in the form of sugars. There's all the raw materials necessary to make this repair. I tell my patients it's similar to a contractor building a home. It's much easier for that contractor to move that construction along quickly if all of the raw materials, all of the materials necessary to build the home are sitting on the lot waiting for him. If the concrete blocks are there, if the lumber is there, if the roof trusses are there, and we don't have to wait for delivery, we can speed that process up. Now, as the raw materials are starting to arrive in the form of inflammation to help us take care of this injury site, the products are used and waste products are spilled out. Those waste products are toxic, they're poisonous, and they need to be flushed away from the body. But the raw materials continue to arrive, and now we have a congestion. We have an excess amount of fluid in a small defined space, kind of like blowing up a balloon. You run out of room, and that puts a direct pressure on the tissues, the nerves, the muscles, the tendons, etc. The waste products start to poison the tissues, causing discomfort and pain, and the raw materials that aren't being used, the proteins, the sugars, the carbohydrates, they're viable. They're not really alive, but they are, if you know what I mean. It's kind of like putting a vegetable in the vegetable bin. And if you don't use that vegetable in a certain amount of time, it's going to start to rot and decay. And that's just exactly what happens to these raw materials as they come in to the injury site. So as they start to rot and decay, they start to throw off toxic wastes that start to irritate the tissues as well. So as a chiropractor, I want to use a method of removing that inflammation, getting that inflammation out of that area. Because I know new, fresh inflammation is coming to bring us more raw materials. I'm getting rid of the toxic waste. I'm making sure that the material does not stay there and continue to decay and cause discomfort and pain. We're getting rid of the pressure that would be appearing onto those muscles, onto those ligaments, onto those tendons. You see, the body's response to all this, if we don't flush it out of there, is to tighten up the musculature to prevent more pain, to block it off, which now causes us to walk differently or move those joints differently due to a muscular imbalance. So we're getting an improper motion on the joint, which is then in turn causing irritation and more inflammation, and thus a continuing cycle. So inflammation reduction is paramount. And you know this is true because when you see your medical doctor, one of the first things he does is gives you an anti-inflammatory. Now, restoring muscle balance and proper movement of the musculature is next on the list, and you know that's true because your medical doctor will give you a muscle relaxant. So the chiropractor is working to reduce inflammation, he's working to break muscle spasms, he's working to restore normal movement by muscles, in other words, restoring a muscle balance, and he's doing this all naturally, through hands-on work, through nutrition, through physiotherapy, through massage, and all these different techniques. So in order to get the results that we want, the patients need to have all of these symptoms removed. They are potentially dangerous. So the thinking that I need cracked in, or the thought that, well, I need a vertebra put back into place or I'm going to feel better, is an outmoded date or way of thinking. What this is going to do is lead the patient to believe that within 1 or 2 cracks that you're going to be better. And nothing could be further from the truth. You need continued care, extended care beyond those 1 or 2 treatments to truly, truly control this condition. Now remember, as a patient, you have the ultimate say on this. You can determine with your chiropractor what you are interested in, the level of care that you expect to receive. I want just pain relief, in which case we'll manipulate once or twice and send you on your way. I want to restore back to where I was before the injury or before the disease. Great. Let's treat until that inflammation is completely resolved, until the muscle balance has been restored, until there is normal movement. Or, hey, doc, I really truly want to recover from this injury because I love playing tennis and I can't play if I don't get myself back to sports ready. In which case we go ahead and we take the treatment a little bit further, develop and restore muscles, improve muscle tone, etc. So there's many, many different levels of care that you can get, and as the patient, you need to be involved in this decision making. I think it is not such a good choice to say, I just need 1 or 2 and send me on my way. Your family physician, your medical doctor, yes, he sees you once, but he gives you a prescription that has 10, 20, 30, 60, maybe 90 pills in it. And you take those pills every day. You take the muscle relaxant, you take the anti-inflammatory, you take the painkiller. So that care is every bit as extensive as what we're doing as chiropractors. The difference is, as a chiropractor, we're doing it naturally. We're doing it with hands-on, and we're doing it with nutrition, and we're doing it with massage, whereas the medical doctor is using a medicine. But both need extended care in order to get you resolved from your condition. So for the 21st century, for patients who are now a little more science savvy, a little bit more educated than what we were years ago, the definition for chiropractic is a natural form of therapy that is used to reduce inflammation, reduce muscle imbalances, restore normal motion, relax the musculature, reduce pain, and restore health. I think that as a patient today, if you are not asking your doctor, chiropractor, medical, or otherwise, to explain to you what he is doing and why she is doing it, then you are not going to get the response that you're looking for. Here at Weber Chiropractic, we endeavor to do that to the best of our ability. Folks, if you are interested in what we're talking about and would like to initiate a response on the Facebook page, please do so. Maybe we can get a discussion forum going. If you're interested in what we're doing here at our office and are interested in our LX program, please give us a call, 724-285-9093. So, folks, remember, chiropractic adds life to your years and years to your life. And until next time, this is Kirk Weber saying, good health to you.